What is going on? Today is February 24th, 2023. In this video, we will be reviewing the catalysts available to us from February 26th through March 4th. If you find any bit of this information helpful, don't forget to smash that like button, and if you subscribe, you'll be kept up to date with any of the new videos that come out. I would also like to extend an invitation to all of our viewers to the Discord group. And if you don't know any of the stages of a clinical trial, that will also be linked in a pop-up at the end of the video. With that being said, let's get a move on. So we will be cruising over to the PDUFA calendar. We have SNY as we discussed last week in the previous video. SNY, they are priced at $47.70. They have a PDUFA priority review date set on February 28th, 2023. Then you have AMGN. They have a PDUFA date extended by 3 months to February 28th, 2023. Advisory Committee voted against the recommendation of approval, noted December 13th, 2022. So right there, that's not a good indication right here. So the advisory committee voted against the recommendation of approval. I don't know how I feel about that. That's CYTK and AMGN. CYTK is priced at $42.81. Along with AMGN, they are priced at $233.66. And last is RETA. They are priced at $44.51. And it reads off FDA extended PDUFA date by 3 months to February 23rd or 28th, 2023. Might want to be careful with these guys. Then up to the 4th, which is Saturday, nothing coming up. Looks like we got quite a bit coming up in the following weeks for PDUFAs. And now to the FDA calendar. Sorted. We've already gone through the 25th. Now to the 26th. We have stock ticker PHVS Farvaris. They are priced at $7.85. Their indication is hereditary angioedema on demand. They are on phase 2 and the date is set for 2/26/23. The catalyst reads, phase 2 trial initiation announced February 26th, 2021. Clinical hold placed August 2022. Phase 2 trial met primary endpoint noted December 8th, 2022. Phase 2 data was presented in a poster at the American Academy of Allergy, Asthma, and Immunology, AAAAI, annual meeting demonstrated that the study met the primary endpoint of reduced attack symptoms, measured as change in the mean 3-symptom composite visual analog scale VAS-3. Score during HAE attacks at at 4 hours compared with placebo. All key secondary efficacy endpoints were also met, noted on February 24th, 2023. Additional data is expected at the presentation on February 26th, 2023. The LOA, which is likelihood of approval, crap. That was not supposed to happen. Okay. Lost ourselves in that real quick. The likelihood of approval, which this is historical likelihood that the drug would be approved based on previously recorded outcomes, indications, and the current stage of the catalyst. The model has been designed from 5-year historical data dating from 2016 to 2021. Important, this is not a guarantee, prediction, or estimate of future results or success. Invest at your own risk. That's LOA. And then if you look at POP, the POP, and that is probability of progression. And it says this is the historical probability of progression from the current stage of the catalyst to the next one based on previously recorded outcomes, indications, and current stage of the catalyst. The model has been designed from 5-year historical data from 2016 to 2021. There's the important notice. So now when you hear me say LOA and the POP, this is what it means. So the LOA for PHVS is 22.59% and the POP is 38.96. Next is CLDX, Celldex Therapeutics. They are priced at $40.12 per share. They are working on chronic spontaneous urticaria, phase 1B, catalyst date 2/26/23. The catalyst reads phase 1B data reported a complete response rate of 57.1% in 1.5 milligram kilogram dose group at week 12 and 44.4% at 8 weeks in 3 milligram kilogram dose group, noted June 30th, 2022. Phase 1B data reported at 100% complete response rate, noted December 6th, 2022. Additional Phase 1B data through 24 weeks for cohorts 1 through 3 and data through 20 weeks for cohort 4 to be presented at the American Academy of Allergy, Asthma, and Immunology on February 26th, 2023. The LOA is 12.85 and the POP is 63.27. Seems like a pretty successful catalyst. Might be worth looking into and investigating and keep an eye on. I know I'll be watching it. Next is BCRX BioCryst Pharmaceuticals Inc., priced at $9.10. They are working on hereditary angioedema, stage phase 3, catalyst date set for the 26th of February 2023. The catalyst reads phase 3, first patient enrolled in January 26, 2023. Phase 2 long-term study analysis to be presented at the American Academy of Allergy, Asthma, and Immunology on the 26th. The LOA is 57.99 and the POP is 65.84. Once again, another seemingly very successful biotech company. Next is KALV, Calvista Pharmaceuticals Inc., priced at $7.50 per share. They are working on hereditary angioedema, phase 2, and the catalyst date is set for the 26th. Phase 2 data to be presented at the AAAAI on the 26th. Phase 3 data due in the second half of 2023. The LOA is 22.59% and the POP is 38.96. Next is BLU, Bellis Health Inc., priced at $7.46 per share. They are working on refractory chronic cough, phase 2B, set for the 26th. The catalyst reads off phase 2B data reported a similar mean cough duration of 11.7 plus 9.99 main and 11.8 plus 11.8 exploratory years, noted on September 6, 2022. Phase 2B data to be presented at the American Academy of Allergy, Asthma, and Immunology on the 26th. The LOA is 17.94% and the POP is 29.61%. Next is BPMC, Blueprint Medicines Corporation, priced at $37.97 per share. They are working on indolent and smoldering systemic mastocytosis, phase 2. February 27th, 2023 is the catalyst date. Catalyst reads phase 2 trial primary endpoint to be updated to mean change in total symptom score, previously a key secondary endpoint based on U.S. FDA recommendation, noted June 9th, 2022. Phase 2 trial results demonstrated superior mean change in total symptom score compared to placebo plus best available care, noted August 17th, 2022, date to be presented at the AAAAI on February 27th. The likelihood of approval is 20.31%, and the POP is 36.91%. Next is SNY, Sanofi. They are priced at $47.70 per share. Indication is hemophilia A, and they are getting a PDUFA priority review. That's set for the 28th. PDUFA priority review date, February 28th, 2023. Now, as we've recently seen, the PDUFA readout doesn't happen exactly on the date. It can happen a week before, 6 days before, the day before, but usually a PDUFA date has roundabout proximity. So plan ahead of time if you do see something come up with the PDUFA review or PDUFA. You might want to take a peek. Also, sell them by the news, sell the hype. The LOA for this one, SNY, is 86.73%, and the POP is 86.73% as well. CYTK is next, Cytokinetics Incorporated, $42.81. Now remember, from the PDUFA page, it said that they had the advisory committee voted against it. So they're priced at $42.81. Heart failure with reduced ejection fraction, HFrEF. PDUFA set for the 28th. And it says PDUFA date extended by 3 months to February 28th. Advisory committee voted against the common recommendation of approval, noted on the 13th of December. The LOA is 83.98%, and so is the POP. Trade with caution. If you do, trade CYTK. Next is AMGN. Same thing, with CYTK. Trade with caution. AMGN is priced at $233.66 per share. They have the same indication as above: heart failure with reduced ejection fraction. PDUFA set for the 28th. And the information reads as the same as CYTK. 83.98% on both LOA and POP. Next is RETA, Reata Pharmaceuticals, Inc., priced at $44.51 per share. They are working on Friedreich's ataxia, FA. PDUFA is the stage set for the 28th of February. Reads FDA extended PDUFA date 3 months to February 28th, 2023. And both the LOA and POP are 87.28%. Pretty high. So it might be worth keeping an eye on. It's not a penny stock, easily manipulated. Can't talk tonight. Remember, look to the left. Look at the previous price action. See where it's sitting at. It looks like it's sitting in the middle. Don't diddle in the middle. You never know which way it'll go. So, anywho, following that one is CYBN, Cybin Inc., priced at 50 cents per share. They are working on anxiety disorders. Phase 1, set for the 28th, 2023. And the catalyst reads off: Phase 1 study updated to be announced, Phase 1 study update to be announced at R&D Day, February 28th. Phase 1 trial to be completed on the first half of 2023. Historical likelihood of approval, 8.65%, and the pop is 57.37%. Next is CYBN again, 50 cents a share. And they are working on, with this one, major depressive disorder and alcohol use disorder. Stage phase 1/2. Catalyst date set for the 28th. And it reads off interim readout from phase 1/2A. Trial due to be announced at an R&D day, February 28th, 2023. Phase 1/2A. Trial dosing initiated. Noted August 30th, 2022. DEA granted a Schedule 1 license to support trial. Look at that. Noted August 17th, 2022. So this is old news that was noted last year, 6 months ago, 5 months ago. The LOA is 6.48% and the pop is 57.37%. We have Cyben coming up again. Anxiety disorders, phase 3, 2/28 on the catalyst date. And it reads trial acquisition completed July 11th, 2022. Update due at R&D day, February 28th. Historical likelihood of approval is 52.7% and the pop is 60.49%. Next, we are looking at RxDX Prometheus Biosciences, Inc. Priced at $117.10. They are working on Crohn's disease, phase 2A. Catalyst date set for 3/3/23. The catalyst reads as follows. Phase 2A trial enrollment completed ahead of schedule. Cool. Noted June 8th, 2022. Old news, almost a year ago. Phase 2A top line data reported that 26% of patients on PRA 023 achieved endoscopic response and 49.1% of patients on PRA 023 achieved clinical remission. Noted December 7th, 2022. Phase 2A primary and secondary results to be presented on March 3rd. The LOA is 17.7% and the pop is 34.51%. These guys seem pretty successful. Might be worth watching. RxDX 3/3/23. Next is RLYB Rally Bio Corporation, priced at $7.72 per share. They are working on fetal and neonatal alloimmune thrombocytopenia, phase 1B, and that's supposed to happen in the first quarter of 2023. So that's coming up. The first quarter is almost done. Phase 1B proof of concept data due in the first quarter of 23. The LOA is 17.51% and the pop is 65.52%. Got a few more to go. So yeah, ETNB is next. 89 Bio Inc. $12.95 per share. They are working on severe hypertriglyceridemia. They are working phase 2. The date set for 3/4/23 and additional phase 2 data to be presented at the American College of Cardiology's 72nd Annual Scientific Session on March 4th, 2023. Phase 3 trial to be initiated in the first half of 2023. The LOA is 17.69% and the pop is 35.41%. Oh no, okay. I was gonna say what did I just read off? Yeah. Nope, that wouldn't be it. Next is RxDX same price as before, 117 and 10 cents. They are working on ulcerative colitis phase 2, date set for 3/4/23. The catalyst information reads out phase 2 cohort 1 enrollment completed July 18th, 2022. Phase 2 trial met primary endpoint noted December 7th, 2022. Phase 2 primary and secondary endpoint data from cohort 1 to be presented on March 4th, 2023. The LOA is 17.7% and the POP is 34.51%. Next is ESPR, Esperion Therapeutics Inc., priced at $6.20 per share. They are working on cardiovascular diseases. They are set as stage phase 3, and the catalyst date is set for 3/4/23. The catalyst data reads off additional data to be presented at the American College of Cardiology's annual scientific session on March 4th. Regulatory submission due in the first half of 23. The LOA is 49.96% and the POP is 59.49%. Looks like they should be doing good here soon. Last is MLYS, Mineralis Therapeutics Inc., priced at $17.90 per share. They are working on hypertension, set at stage phase 2. The catalyst date is 3/4/23, and the data reads as follows. Phase 2 study met its primary endpoint was statistically significant and clinically meaningful reduction in systolic blood pressure in an inadequately controlled hypertensive patients. That was noted November 16th, 2022. Phase 2 data to be presented, forgot the E, at the American College of Cardiology's 72nd Annual Scientific Session on March 4th, 2023. The LOA is 17.69% and the POP is 35.41%. So that's it for catalysts on the FDA calendar up to the 4th. We will look at the conference calendar, see what's coming up. So it doesn't appear to be anything going on until, okay, yeah, that's in March. So we are looking at the 24th. So we're looking at Maui Derm for dermatologists. Then you have the DDR, which is DDR Inhibitors Summit. Then you have Molecular Glue Drug Development Summit. And that's going to be happening on the 30th through the 1st. And yeah, as I mentioned before, that's it on, 30th and the 4th. Or was it not the 4th? Oh, okay, yeah. Nothing. Oh, shit. Maui Derm for dermatologists, yeah. DDR Molecular Glue Drug Development Summit. Sorry. Yeah, that looks about it. So this is the end of our reel. Until next time, see ya.